Hi, I'm Lynn Bridgeford from the Ayurveda Bias Clinic and Ayurveda Bias Yoga, and today I'd like to share with you some gentle exercises to help release tension in the jaw. So all you need is a place to sit, your hands, and a space to be relaxed. And join me. There are many reasons we can have tension in the jaw. Sometimes it can be from neck tension because everything connects to everything else. Sometimes we can be biting our jaw, biting down on our teeth because we're stressed and the jaw is kind of hardwired into the stress system in the brain. And other times it's because we have what's called malocclusion, so we're not biting well. So if our teeth aren't properly aligned, we need to be seeing a dentist. If you have a serious TMJ, that's temporomandibular joint, this is the temporal bone, this is the mandible, this is the joint. So if you have a serious dysfunction there and it needs medical, dental attention, please do see your dentist. For now, we're just going to check some movements. So if we bring your hands just to in front of the earlobe, just where the jaw, if you move, open and close, you'll feel some movement under your fingers. Just very gently tuck the elbows in. Feel the movement if you open and close. And if you take the jaw, lower jaw side to side, forwards and backwards. It can look a bit funny, don't worry. Check it out, one side, the other. Forwards, backwards, open, close. We can check a bit stronger, so bite, close. Open really wide. Take the lower jaw to the side really as far as you can go. And the other side. Forwards as far as you can. And backwards. So just notice what that felt like. We're going to do a few neck exercises first. I have a video on very detailed neck exercises, but we're just going to do a few to release all the attachments up to the jaw. So bring the shoulders up and down. Keep the neck in neutral, so nice posture with the shoulders above the hips, crown above the base. Nice soft place for the neck with the base of the skull is soft and there's no tension, just looking straight forwards. We're going to bring the shoulders up and down, up and down. Turn to the right, take a few deep breaths in and out because the heart and the lungs attach to the neck, and of course the neck attaches to the jaw. Come back to the front, turn to the left, a few deep breaths in and out. Come back to face the front. We're going to take hold of, with the hand, we're going to grip the meaty bit, the trapezius muscle behind the shoulder. So not going into the neck, but just up the shoulder, squeeze it, give it a little knead up and down. Hold it tight at that meaty bit at the top and gently incline away. Take a few deep breaths there. Just allow that muscle to relax. Let the head be nice and relaxed, so the weight of the head stretching through the muscle. And we're having a little chat with the belly of the muscle. Come up on the inhale. Going to take the other side, so squeezing. So a little squeeze up and down just behind the collarbone, at the back, a little thinner out to the side. Come up to the meaty bit at the top, stop there, hold it tight, and gently incline away. So we want to be towards the back, so we're not squeezing any blood vessels at the front. Let the head relax. Find that nice soft neutral point. There's no tension, less is more. We just allow the weight of the head to take that through. And come up on the inhale and roll the shoulders back and down. A few good rolls. You can do one and then the other. And roll forwards. We're going to take a stretch on the front of the neck gently. So take the hand with the palm facing forwards, thumb in, and we're going to slide this along the collarbone, so right along the edge of the collarbone. We want to keep on that and just let the hand lift up, so we roll down over the collarbone because the first rib is underneath. So roll the hand along that collarbone, lift up the thumb, lift up the little finger, let the thumb roll down, bring the hand down. So we're holding onto the top rib, it should feel comfortable. Other hand on top, relax the elbows down. And gently incline away, so we're getting a sweet stretch all through. the muscles at the front. It's not too strong, just a gentle stretch, nothing tense in the back of the neck or anywhere else. A few deep breaths in and out. Let the head relax there, come up on the inhale. The other side, palm forwards, thumb across. We're going to take the thumb along the collarbone, lift the little finger side up, roll that thumb down, bring the hand down, other hand on top, and relax down. I've got a better description in my neck video. Hold on to that, let the elbows relax, and gently incline away. A few deep breaths in and out, let the head relax. It should feel comfortable. Just a nice stretch. Come up on the inhale, and just have a little wiggle. So we're going to just go back to feeling what's happening at the jaw, see if there's any difference. So open wide and close. Take it to the side, as far as you can go. Other side, forwards and backwards. So if there's any tension from the neck affecting the jaw, that should have made a little difference. We're going to look at a few muscles. We have the temporalis muscle. This is the temporal bone, and it joins onto the jaw, joins into there, the mandible, temporomandibular joint. There's a big fan muscle here called the temporalis. So we're going to put our hands on that gently and just move the jaw around like you're chewing, and just feel what you feel under your hands. Then we're going to give it a little rub. So we're going to rub all the way around above the ear. Give a few little circles on that muscle. Remember, it goes big like a fan. Little circles, not too rough, just enough to give a little bit of pressure and to just ease that muscle. So gently rubbing all the way around the temporalis muscle. Put your hands on it again and feel the movement. Then we're going to look at the masseter muscles, chewing muscles that are lower down in here. And we're just going to put our fingers where we were feeling the movement and give a little rub there. Just get in enough to, not to hurt, just to give a little rub, ease the muscles. You can just let the jaw relax and rub through. You'll find perhaps a few tender bits if you're not used to what it feels like. Just feel if you feel anything under your fingers, and you'll know the tight side because it'll be the one that you normally feel tight in. Give a little rub all the way around. And then we're going to check the movement again, so just open wide and close. Take it to the side and the other side, forward and backwards. So we're just checking each step of the way what we've done. So we're going to get the thumbs forwards and we're going to wrap them around the edge of the mandible here. So this is a bit that comes down the side. So we put our fingers down this side bit, our thumbs down the side of the mandible, keeping very relaxed, and just let your elbows come together, head's relaxed, and you're just holding on with your fingers coming up. Nothing, less is more. In cranial osteopathy we do very gentle movements. So we're just holding this with an intention of allowing it to soften down. It's a bit like when you take a bin bag out of the bin. If you pull it, it gets stuck. If you ease it very gently, it comes out. So this is what we're looking at with easing the jaw. So cup the thumbs around the edge of the jaw, the mandible. Bring your elbows together and just cup that gently. And let your elbows sink a little bit down to the floor, so you're giving a little bit of traction, a little bit of pull down. And remember that bin bag. We can come a little higher up, so we bring the fingers on the temple and just hold that very gently, and still holding the back of the mandible. And breathe. We're giving a very gentle pull forwards and down, but it's not even a pull, it's just almost like an intention. And breathe. Keep everything nice and soft. We can also take the fingers and we're just going to hook them onto the tissue at the top of the jaw. So it's very soft, as though we're putting them on a sticky on a wall, so we just have them very softly on the jaw. Bring the elbows together so you can be relaxed, and we're just letting the weight of the hands just pull down on that jaw. Breathe. It's good to be really relaxed when you do this. Let the jaw relax. Breathe into it. If you pull, it'll pull back, so we just want to be very, very gentle. You'd be surprised how much you can do by being really gentle and letting the body respond. We can also do a few sort of isometric exercises very gently. So putting the hand alongside the jaw, and keep your hand still and push the jaw against it very gently. If you've got any clicking going on, don't let it click too much, or if at all, just push out and relax. Push out and relax. Push out, push, 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 and relax. On the other side, push gently, so it's not really moving, you're just getting a bit of action between the jaw and the fingers. Bring them to the front, bring the hands to the front and push forwards and relax. Push forwards and relax, and push forwards and relax. So to push back, we need to contact the back of the jaw there, just with the fingers facing forwards, and gently push the jaw back, very gently. It won't feel like that much is happening, but be very gentle with it. And to push down, to open the jaw, so push the jaw down against the fingers and relax. And you could do it on your knuckles if you like. Push down and relax. And again, push down and relax. Again, not to create popping, just to create a little bit of working in the muscles. We can also put the fingers inside the jaw and push up and relax. And put the fingers in the jaw, clean fingers of course, push up and relax. Have a little wiggle of the jaw, open wide, to the side and the other side, forwards and backwards. Roll the shoulders. Let's feel what we've done here. Open wide, to the side and the other side, forwards and backwards. To finish off, we can do a few simple exercises with the soft tissue, bringing your hands to the jaw and blow some raspberries. The other one you can do is taking your tongue around the inside of the mouth, like you're chewing a toffee. Really work the tongue, because the tongue is also important with the jaw. Thank you so much. That's just a few simple exercises, gentle exercises. Please do more neck exercises from my other video to help you with that, and be gentle with your jaw. Thank you so much. Thank you for joining me. I'm passionate about sharing my yoga journey and all the wonderful things that yoga has to offer for our life and our benefit, and I really look forward to sharing more with you, and hope you join me more on my journey. Please like, subscribe, chat to me, ask me any questions, and connect with me on my other channels. There's YouTube, there's Instagram, there's LinkedIn, my Facebook page, my website. So thank you so much. That's Lynn Bridgeford, Aether Bios Yoga.